Welcome everybody to the March 2024 Health Equity Webinar Series. I am Lydia Isaac, the Vice President for Health Equity and Policy here at the National Urban League, and I thank you all so much for joining us for this wonderful discussion. I'm really delighted that we have our panelists with us who I'll introduce, and then I'll let them say a little bit about themselves. But as we have said before, this series is about highlighting particularly the social determinants of health and their impact on well-being and health of populations that we care about. And so today's webinar on housing and health is really talking about the association between housing, community development, and the neighborhoods that people live in and how it impacts their health, to support it and sometimes to not make it as great as it can be. So I am delighted and excited and so grateful for the three panelists that we have here with us, and I'm going to introduce them briefly, and then they're going to introduce themselves and tell us a little bit about the work they do. So who actually happens to be sitting to my left, because we're in the same room, but you all can't see, is Michael Collins, who is the Vice President for Housing and Financial Capabilities here at the National Urban League. I'm just going to go by our the squares in my room and in my Zoom. The next person is Dr. Ruth Thomas-Squance, who is the co-executive director at the Build Healthy Places Network. And last but not least is Greg Miao, who is works on legal issues and is a senior attorney at Change Lab Solutions. So welcome everybody. Thank you for being here. I think I'm going to start off with actually, Greg, I'm going to start with you. And I may not have been on the Runner Show, but I'm going to start with you. Tell us a little bit about what you do at Change Lab Solutions and what is the connection between the legal framework and the legal work that you do in housing and health.
Sure. Thank you, Lydia. So Change Lab Solutions is a national nonprofit organization that uses the tools of law and policy to advance health equity. And housing is one of the primary areas that we focus on, given sort of the really strong association between, our housing laws and policies and the health outcomes in our communities. And for us, it really, it spans the gamut of sort of all the different laws and policies that actually help shape, what we call the legal determinants of health, right? And so for us, there's the laws and policies that relate to things like affordable housing. There's laws and policies that relate to sort of where housing's located, and laws and policies that relate to the safety of housing, as well as the laws and policies that relate to how people are able to stay in their housing. So to us, we really see the housing space, and the housing challenge that our community is facing sort of being those three things, right? Safe, stable, and affordable housing. Those are the things we want to provide. And those are the challenges that we're facing, is that, in too many places and in too many communities, we either have laws that work against the provision of safe, stable, and affordable housing, or they enable sort of some predatory practices that sort of really can harm our communities. And even some of the more neutral, laws and policies that are out there can actually have really sort of detrimental compounding effects, especially because all three of those challenges really relate to each other. So to us, in our work, what we try to do is help people understand, what are the laws and policies that are on the books that are helping shape what the sort of housing landscape looks like in their community. How do those relate to each other, right? What are our zoning laws looking like? How do those relate to our landlord-tenant laws? How does that influence how people, experience, housing stability or housing instability? How much does that impact how they find new housing if they have, unfortunately been forced out of housing and for one reason or another? And what is the type of housing that they're looking into, right? Are they getting into, quality housing, or are they, being forced to sort of choose to rent from, unsavory landlords and that are renting out, uninhabitable or unsafe places? And so what are the laws and policies that we need to look at, and at the state level, at the federal level, and at the local level, to shift the dynamic within the local housing landscape? And particularly, we spend a lot of time working with local communities to understand, what's the role of local law and policy, right? What can we do as a city or as a county, so to sort of make that direct impact on improving the health outcomes for for our communities? And then how can we sort of leverage that into, those other legal systems at the state or federal level, and what might we want to change or enter into coalition with other communities to try to make shifts and changes at those different levels of government. So that's a little bit about our work, and I'll pass it on.
No, that's great, Greg. And I'm sure some of our affiliates who are on this call are going to have specific questions about what they could possibly do in their local communities. And I think that's a really wonderful point that you brought out, that this happens at many different levels. And so the local communities are a really important level. And because our affiliate network are in local communities, it's important to understand how those laws can be different and shape the landscape in which people live. So I'm going to move it on to Ruth, and just give us a talking about, I love the way that you're trying to build healthcare connections within the community development space and the work that you're doing. So can you talk to us a little bit about what you do and how do you do that?
Yeah, definitely. Good morning from West Coast to everybody. So my name is Ruth Thomas-Squance, and along with my colleague Colleen Flynn, I'm a co-executive director at Build Healthy Places Network. And we're a woman-led national organization, changing really the way sectors work across sectors, really, so that together we can create communities, where everyone has the opportunity to live those healthy lives. And part of the position that we take, we're in a slightly unusual junction between public health, community development, and healthcare. Where we focus on transforming the way they work together. So the idea is to then create community-centered investments that can advance racial equity and then improve the factors that we know as social determinants of health that impact people's health around the well-being of all communities. So in our approach, we use partnership, platform, and process. So we serve as thought partners to national organizations across those different sectors that are thinking of doing cross-sector work and emphasizing inclusive approaches. So we really want to lift up community-led solutions and really kind of leverage our platform, which is a wide and slightly unusual audience of a cross-sector platform to build the field, lift up case studies, and sort of in a way we'll have a unique audience that we might have healthcare coming, and we can bring up community development news or things that should be relevant to them that they may not normally come across. So we sort of sit at that unusual intersection where we do that work. And then we also embrace the process of reflection, so seeking accountability with our partners, and especially thinking about how we can emphasize centering community in the solutions that we create.
I love that. And before we move on to Michael, I want for this audience for you to define community development.
Oh, community development. Yeah, so for us, we try and bring together, because when we speak with community development, with public health or healthcare, there can be different interpretations of what the community development is, as opposed to the community development sector that we know of that is creating affordable housing, grocery stores, community clinics, and sort of trying to embrace that health will go, health in the community development sector will be wider than just building a clinic. So quite often we might discuss with a community development organization, do you do health? To know, or they might think of it as limited to that bricks and mortar clinic that they're creating. Whereas, as Greg sort of outlined, health is in all the work that they do. When you're creating safe and affordable housing, you're doing health work. And I'm happy to talk a little bit more about that later too.
I love it. Thank you. So, and last but not least, Michael, who is one of our own here at the National Urban League. Tell us what you're doing and how did you come to this space?
Is really working with our affiliates, which we have a network of about 30 housing counseling sites to really deliver high quality social services around housing supports. I think one of the things, being relatively new to the league coming in the last year, that stood out to me was really taking a step back to analyze our work and to think about it in a more intersectional and multi-dimensional way. Beyond just the social service agency, we kind of have this empowerment goal that drives our work. That's every American should live in safe, decent, affordable, and energy efficient housing. And if we look at the research, the health outcomes associated with every one of those categories are blatantly obvious to someone who may be interpreting it. But we have not always, well, until I've gotten really arrived, I haven't seen an explicit focus on this. What I did is step back to look at both our programmatic and advocacy work, really to identify what is the work we're doing in the housing space and how are we positioning ourselves more effectively to really understand the depth of how housing impacts our lives and our health. And so what we've kind of begun to look at our work is in three distinct bodies, really looking at how do we ensure people are able to access, secure, and sustain their housing. How are we equipping them with the financial tools in order to support that housing and generate wealth? And through some emerging initiatives, we'll talk about what are we doing to inform the development of housing and that the supply that's created in our community is responsive to those goals. But I go back to that empowerment goal of that safe, decent, affordable, and energy efficient housing. And in my mind, there's no way that we're not talking about health and the impacts, especially as we'll get into a little bit later. I know something that's new. There are climate implications that really impact our communities, and communities of color are kind of the canary in the coal mine. And how are we supporting those communities to weather the storm and ensure that their long-term sustainability and health is taken into account?
Fantastic. Thank you, Michael. I appreciate it. So I think Michael and everybody's introduction brought me to my first question, which kind of was answered already, but I want us to be more explicit. There are going to be people who are on this call. There are people who listen to this call who will say, why housing and health? Like, why should housing people, why should community development people, why should people who are trying to help people buy houses care about health? And so I just would like the panel to talk explicitly about why housing is so important for health. And anybody can take this.
Do you want to go first, Greg?
Sure, I'll take a crack first. You know, I mean, I think to make it really tangible, you know, there's so many connections. So I'm going to try to go for the affordable, the quality, and the stability aspect. And, you know, I think the energy efficiency, as Michael mentioned, you know, in our mind kind of can fit within that, but it's also, you know, I understand why you might separate that out. But, you know, first of all, when we just talk about housing affordability, right, we're talking about basic needs, and you know, the way that people experience, you know, their life and their you know, we don't want them making choices between, you know, am I feeding my family or am I paying my rent, right? We don't want them to choose, am I doing healthcare or am I paying my rent, right? All of those things, you know, all these income issues really are related to each other, and sort of all the health issues that come from income constraints and, you know, demands on income really are related. And housing is just a huge portion of that, right? You know, we've got so many people in our communities that are paying, you know, what we consider to be very unaffordable rent. And, you know, you might even think that 30% of your annual income, right, as you go into the rent is kind of ridiculous anyways, but that's the threshold that we're using. And we've got people paying 50, 60, 80% of their income source just to be housed, right? And it's such a foundational aspect of health, right? You know, just think about, you know, if you don't have housing, what are the different health impacts that you're experiencing? You know, if you're living in your car, or you're living on the street, or other factors like that. So affordability has so many sort of direct relationships to the sort of health outcomes that people are experiencing. And, you know, we get that for the quality of the housing too. You know, we do a lot of work there, and you see lots of really terrible housing out there, and we haven't invested in it, and we don't have the programs that support it. And, you know, so we've got, you know, pest infiltration, you've got, you know, things like, you know, lead paint that, you know, is still a major impact on children's health. You know, we've got a lot of environmental contamination or things like that exist within housing, you know, lead and sort of mold and asthma triggers. So there's a lot of things that in the physical space of the house that can impact health. And then finally, you know, there's a really emerging, growing literature on the impacts of housing instability, you know, experiencing eviction, experiencing homelessness. What does that do to your physical health? What does that do to your access to care? How much people can actually stay in contact with you? So we've got continuity of care issues, and we've got issues, you know, certainly related around a lot of mental health challenges, right? And you know, that can have compounding impacts too, you know, where we get people who sort of get essentially blacklisted from re-entering their rental market when they have sort of a series of evictions on their record. And so these, you know, these health challenges are both distinct, but they're all interrelated because all of the housing challenges are interrelated. So I'll pause there though and turn it over to my colleagues.
Great. I'll jump in. So one of the things we think about PN is that as we're working,
Just to know your mic is kind of
no,
stuff.
too loud, did you say?
No, it's you're garbling. I don't know if it's
Is it better now or just interesting? And it was
if not, we'll go with it. We'll go with it. Don't worry about it. Go for it.
Okay. I mean, no subtitles. Sorry. I think we think about PN is that we're setting ourselves the goal of achieving health equity. You know, we really have to force ourselves about what we mean by health, and that is beyond the absence of disease and thinking about how we thrive. You know, one framework that we use anyway that's around the social solutions of health is the 7 vital conditions of wellbeing that come out of the Ripple Foundation, really health. And what we like to emphasize is the multifaceted nature of our systems that go in to make up our social, physical environment where they combine to impact our community's health. So we know that the 7 main domains within life classification, thriving natural well-being, clean air, water, meaningful work and wealth, which we've talked about, and housing, and it's centered around the belonging, which I'll come back. But so I feel that you know this sort of framework can help us think about what levels we've got to impact health, and make a sense of the connections around these factors that are creating the sort of connective tissue right in trying to achieve health equity. So what we know is that, as Greg mentioned, you know, outside of medical system accounts for about 80% of our health, those factors that are not actually just sort of medical interactions. And because what we know is that these factors maintain our well-being, but because of geographical distribution of these factors, they're not always plentiful, and they've been shaped by race-based policies and practices that are built into our systems. So we know they are the causes of health inequities that disproportionately impact communities of colour. And the distribution and location of safe and affordable housing has been impacted by racism over generations. So this is a huge impact on health outcomes because housing is such an anchor to a whole host of health-related services. They have to be in a place. And while we often associate housing quality with issues, such as lead emission, air quality, the impacts on asthma, those are all very, very real. But housing has so much greater reach. Just from the fundamental sort of, do you have a safe and predictable space to store your medications? If not, how is that impacting your health? One study that came from the Miao Foundation, they found that poor housing quality was the strongest predictor of emotional behavioral problems in low-income children and youth, mediated by stress and health. So I mean, the loop of that is how does that affect your education system? How is that going to look back and then impact your employment and wealth-building in that community? So there's such an interconnected nature of all these factors that impact health. And it means that most of us who don't think we're working in health really are working in health. And so I think if we're going to try and create thriving population, it's going to really require us to work across sectors and ensure that all communities have these different conditions and factors necessary for health, and housing is right up there as a system.
Thank you, Ruth. Ruth, you also may want to try to log back in and log out. We got it. I think I heard most of it, but it is a little garbled. So just so you know, but I also want to just summarize for people real quick for who may not have heard it, that, you know, Ruth talked about racism being baked into our systems, the fact that we have healthcare systems that don't always work to support people in the way they need to be supported. I think that was a really important point that she made. And she also made a point about the fact that, like, for example, somebody needs to refrigerate a medication and does not have affordable housing or have housing in general, to be able to refrigerate a medication, then that has a direct impact on their health. So this connection between housing and health is a great one. Michael, I just wanted to know if you wanted to put some stuff out there.
Yeah, I do. I think this is an interesting conversation because earlier in my career, I entered through this field through a space of really philanthropy and research in a very like nonprofit distillate way. And one of the reports that kind of changed my career was one that looked at housing and how through the zip code you were born into or live in, they could almost chart your life where you would land health-wise, financially, educationally. And I was like, this is a need. We understand the impact on our communities and the most vulnerable communities. Housing has much more importance beyond being the largest driver of wealth for most individuals, beyond being the largest item on any household's balance sheet. How are we looking at this issue more expansively? And so as I've progressed, and even in my current role, it's always been, how do we leverage housing as a platform to ensure that we are creating a foundation to generate better lives and outcomes and really be able to disrupt intergenerationally? And so I guess through that lens, that's really what's driving a lot of our emerging work around working with affiliates within our network to help them build up and optimize their real estate development practices. How are they active agents in their communities, driving development and change, and doing so in a way that's beneficial, holistic, and looking at housing through that comprehensive lens? And then through our advocacy and other initiatives like our climate work, really looking at how are we empowering and ensuring that homeowners, renters alike have the tools, skills, and infrastructure in place to live healthy, thriving lives? And so it's really, and I appreciate Lydia for inviting me here. It's really like, how do we start to build linkages and understand that we have shared goals of improving our communities, of improving the livelihood and lives of those we serve? But are we really jumping into the conversation? And I think, as Greg said, it's really that we're looking at this as there are linkages that tie this together, and it can be a bit overwhelming, but through programmatic or other options, and you've heard from all of us, really, how are we doing so to push the needle and to ensure that, our folks' physical and mental health is really honored?
So I think that's a good point that I want to shift us into our next question, which it seems like obvious, but I really want us to talk through, like, how did we get here? Like, how did we get to a place where, like Michael just said, where you live or where you're born can determine your health outcome that early, or that there's a difference of, I think there's a statistics that, it can be a difference of a mile and it adds 10 years to your life expectancy. What happened in the housing sector and the community development sector that got us here? And I would love for us to talk about inequities. I think understanding the root of the inequities is what helps us find solutions to the problem. So anybody can take this or start, but I would love to know how we got here.
Shall I just test my microphone? Can you hear me?
It's perfect now. Yes.
Great. I'll just jump in. I think, so part of what I was saying earlier that you considered, I think how we got here is because all these different factors that impact health have a geographical distribution, and that has been dictated through policies and practices that have disproportionately impacted certain communities by lack of investment, lack of access to those various resources, including safe and affordable housing, so that you end up with this disproportionate health outcomes, but also things like life expectancy that can be dramatically different. And I think that really just speaks to the number of different factors outside of just medical access that can impact your health.
I would augment this, I'm going to be this guy. I would say we go back to really understanding an explicit policy that's dictated this is redlining. The Color of Law is an interesting book, and if you haven't read it, I would suggest. But it helped me to see that there was an intentional, structural, and methodical way in which our communities were broken up. Investment, whether it was a mortgage loan and or industrial development, these were very intentional decisions that were made in the past. And we understand now the communities where we were relegated to, where we were able to get deeds, mortgages, or rent in, were those who had challenges that led to poor health outcomes. And so I think, you know, we're always behind the 8 ball, but one thing that kind of resonated me was there's an exhibit that's kind of traveling throughout the US. It's called Undesign the Red Line. And if you ever get a chance to look it up, if it's in your local community, there are these huge maps they show of your city or your state, and it shows which communities were redlined. And if you just take a moment and imagine where your industrial sites, Superfund sites, where there are potential obvious health yikes, I'll call them, it's where we were relegated to live. And so undoing that is a difficult task that we're all ever working on. But if I pointed to one thing, I would say the practice of redlining absolutely codified a lot of our residual health outcomes we continue to see.
Yeah, I'll just hop in to add on to what Michael's saying, because I 100% agree. And, you know, I think what we really have is when you think about sort of the two systems of power, right? We've got the economic system that we have, right? We've got this very, you know, capital-based system and a commodified housing market, right? And there's a lot of institutionalized discrimination and racism baked into the way that the private market worked. And then we had the way that that was interacting with government and government regulations and laws that also codified and had a lot of baked in, you know, explicit, you know, intentional, you know, racism and structural discrimination. And these are sort of the ways that the systems of powers were perpetuated. And so to us, you know, I think redlining is a really great example. And I think, you know, you could look at the urban renewal laws and blight designations and, you know, the way that the highway administration, you know, expanded the highway system. And, you know, we've got a lot of different sort of very intentional, you know, acts, right? Like very purposeful acts of government that really did create, I think, these geospatial disparities, right? And that interacted with, you know, the market system that we used as well. And instead of being a balance to the discrimination that we might have expected to come out of the market, we actually, like, you know, intentionally harnessed or reinforced a lot of that. And so it's going to take a lot of act, you know, to sort of figure out what's the relationship between law and the market, and, you know, to sort of counterbalance maybe some of those, you know, discriminatory forces that are still, you know, present in, you know, in our society today, as well as to then also directly redress, you know, these, you know, the highway expansion or the redlining, you know, how can we actually remedy the things that government really explicitly did to reinforce, you know, these health disparities that we see today.
And Greg, I think it's a really good point when we talk about, like, you know, where we put highways. You know, we're in New York, and, you know, the BQE was particularly one of those big highways that was intentionally put through a certain neighborhood for a reason. And now, you know, there's all this redevelopment happening. I know that in California, and I want to say it's either San Fran or Oakland, there was this big highway that was put right through a Black community. Didn't they just recently tear it down? Is that the one that they recently tear down? I tore down, I could be wrong. But I remember there was this whole movement about tearing down this highway and building one around the community because people couldn't get from one side of their community to the other because there was a highway right in between. And that was intentional, as you said. And so how we build these infrastructure. So my next question, unless Ruth, you wanted to answer this question, I want to get to you just in case you want to answer it before I ask my next one.
No, I totally agree. I think that, just like Michael and Greg have said, I think that we've codified these things into geographical distribution, and that coding has been in a race conscious way, that it was very specifically designating certain communities. So I think I would say that our approach to deconstructing that has to be in a race conscious way, and to really address where those harms have been impacted, and to think, like I think Greg mentioned it, about redressing that. You know, that we can't just say, okay, we're not doing it anymore, hands off, because it's already embedded in the structures and systems. So we have to do some redressing, some undoing of that.
So I'm happy I let you answer, because you actually led me right into my next question. What does that mean, right? How do you do it in a race conscious way? And how do you redress the issue? Because most of the folks on this call, as I said, are Urban League affiliates who are working in communities. So what can they do, whether specifically policy-wise, not who should they talk to, but a broad-based idea of like, how do we start pushing back on these systems that have created this environment that is not health promoting, right? That has created, Greg was talking about, unhealthy housing, unstable housing, not quality housing. What do we need to do as a community? And then in the larger phase, I think we can do local, state, and national. Give us some ideas of the kind of ways we can start to push back on this system and start to improve the way our communities are built and the way that our communities are supported.
I can jump in. One thing that we do is just one specific approach that BHPN takes is around that multi-sector approach. So changing to a systems thinking approach that's good for solving these large scale problems, because I think then it can increase your range of choices at your disposal and who you're working with. So I think when you're addressing root causes, you have to sort of think broader. So you'll be thinking about housing, but that sort of whole ecosystem of who's working in those communities. And so one thing, we just finished a partnership with the National Association of Chronic Disease Directors. So state directors of chronic disease, their departments are running health programs, running chronic disease programs, addressing policy that impacts health. And so when we came together, because we believe that by joining forces, I think public health and the community development sectors can transform ways that we approach health and well-being. And that can be around opportunity-rich environments with high-quality housing and community infrastructure that's working sort of against that disinvestment system that we've just spoken about earlier. So one thing we produced was a primer that was about public health engaging community development for health equity. So really exactly getting to that point of redressing. And it's just a starting point for the work and a reminder to challenge our perspectives of where health and place intersect. And who we partner with when addressing the drivers of health. We've got some emerging themes from it. Sort of an ecosystem is called a health ecosystem, but it shows who's working in it. It could be the school system, it could be the library system, it could be, your local public health department. And where are they working in community? Where can you have intersections? And some of these things can mean the reality of having to braid and blend funding sources that come from these two different sectors, but that can intersect in the same place. Addressing, climate justice is a great example. It is, to do with the physical changes that we need to make in our communities. It's also the biggest public health crisis that we have coming down the pipe, because as we know with those redlining maps, you can intersect sort of heat maps in the same place. People who have less shade, less green spaces, more concrete. So, as we've sort of said earlier, those embedded systems of disadvantage are kind of hardwired in there. So it's going to come up with every sort of issue that you're looking at. So I think there's a real power in being able to sort of work across sectors, have different sources of data, different insights, different perspectives on funding that you can bring together with a multi-sector approach.
I love that. And not only concrete and heat, but also who's more prone to flooding. We know the low-lying areas. We can talk about Katrina and New Orleans. The low-lying areas of people who are most vulnerable were the ones who were more likely to live in those areas. And now they can't get flood insurance, right? So you also are perpetuating the inequities in even the way that they can support themselves if that happens again. And so thinking about those structures, it requires a private public, because insurance is private, right? Insurance is not public. So how do we make laws that support people who may live in those areas so that they can be covered when and you're 100% right, not if natural disasters happen, when they happen, because we're seeing they're happening much, much more as time goes on. So anybody want to also answer this question? Go ahead, Greg.
Sure, I'll hop in. I mean, I think there's like there's a lot of different ways, and I really agree with Ruth that I think bringing like an intersectional approach to the conversation is really important, because I think there's a lot of coalition building that needs to happen, and I think having multiple frames and being able to sort of expand that conversation and expand coalition is really important, because really what's going to make the difference, right, is when you adopt new laws and policies that acknowledge the past harms and are directly trying to respond to them. There's definitely like some legal considerations in terms of race conscious policy. We've had obviously the Supreme Court's decision that's thrown a lot of our sort of race conscious legal frameworks in the air. TBD over the next 10, 15 years of litigation, what the new boundaries are. And that's going to make it hard to do explicitly race conscious work without obviously some risk of legal risk of your new policy being litigated or whatnot. But that doesn't mean you can't do race conscious policy making at all. And I think there are some ways, things that listeners and attendees can sort of focus on. One is the role of just participatory governance, right? We need to really focus on the power building aspect of working with grassroots organizations that are in these communities to help them really share their story, share their experience, and get the audience in government that they really need to be able to have sort of laws and policies that are adopted and developed in response to that. So I think that there's a big sort of participatory governance thing that we need to work on. And then I think that there's another aspect of sort of grappling with history, right? Can we acknowledge what the actual, when did we adopt specific laws and policies in our communities that actually created these harms? Can we acknowledge that those were intentional? Can we acknowledge that, the racialized or, discriminatory impact that those had? And what can we do about it? There's a whole conversation around sort of what the legal boundaries of sort of reparations-oriented laws are, and I don't think we've got time to go fully into that. But I do think that there are ways that we can focus efforts and we can prioritize communities. And there's we've mentioned a little bit about sort of the environmental impact, right? The climate impact on these communities. There's a lot of proxy, criteria that aren't based on just race, right? They are based on exposure to, climate change that would have very positive impacts, in addressing sort of the racialized history of some of our, discriminatory laws and policies. So can we use things like, in California, we've got CalEnviroScreen or other, risk audits, like tools that exist out there to understand sort of how is this going to impact different communities, these different changes in climate change, and can we use those types of tools in a way that actually helps prioritize funding and prioritize resources for those communities that are most at risk.
Michael?
Yeah, as I reflect on this, I get immediately kind of tactical, but I guess this is what we do day to day, trying to support our affiliates and communities. So I think one thing that stands out to me is our current D3 campaign. Really, it's based on demanding diversity, defending democracy, and defeating poverty. And although we are in a space where race-based initiatives, explicitly race-informed funding opportunities are under fire, we live in communities that unfortunately are highly racialized. We have historically, as an organization, served the African-American community, but community demographics have shifted so much that in some of our affiliates, the Latin community is our primary supporter, and in others, it is white Americans. And so I think really focusing on who our local communities and neighborhoods are and mobilizing those forces are a way of supporting ourselves, because unfortunately, the dirty secret in America is we live in segregated communities. I also am kind of reflecting on meetings that were occurring in New York and California, You know, there are public hearings around the development of affordable housing. There are zoning committee meetings, and on the surface, they seem super technical and outside of our bailiwick. But as Greg mentioned, in a participatory government, we are invited into those spaces. We are invited to speak on behalf of our neighborhoods and communities. And I think for us, it is incumbent that we leverage that power and step into those spaces, because this is what drives our lives. This is the ability for us to go to work, to access proper health care, to live in safe communities, to have affordable housing. And often these spaces are seen as maybe not as inviting or welcoming, but that we should be engaged in those spaces as well. And showing up in community, which shows up who's in, and then is a reflection of who's in that community and where our values lie.
So I love how you all bring me to like the point that I'm sure people on this call who have hear from me a lot are tired of me saying it. But I think it's a really important point that everybody just made about, one, participating in our government, right? Defending our democracy, about getting active in policy change and laws that change, and laws then lead to regulations that talk about how policies are implemented. But also, I think Greg's point about coalition building, I also want to bring some kind of levity a little bit, because it's hard work, right? Y'all, everybody here, we know we're talking about multiple systems, multiple sectors, talking about racism, we're talking about all this stuff that you all don't need to do it on your own, right? The value of an urban league and an urban league affiliate is the message and the trusted messenger that we bring to the space about what's going on in communities, that we can partner with other people and be in coalition to drive change, right? So I mean, many of y'all are fantastic and do drive change on your own, but you drive more sustainable and lasting change when you partner and get into coalition with others. And a lot of times, part of the roles and I think the great benefit of urban leagues is that we become the convener, right? Let's get people together. Let's talk about this. Let's see how we can drive change. And y'all know what I'm going to say, because everybody knows I extol it on almost every single webinar. Vote, 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 vote. There's a reason why we have a Reclaim Your Vote campaign. There's a reason why voting is so important. We're seeing it. I think Greg's point about what's happening at the Supreme Court, that we know was only for higher education, but is trickling down to all sorts of race-conscious policies, is that who we put in office at the local, state, and national level has repercussions for your daily life, not only the Supreme Court, but your local courts, your mayors, who controls your police departments, who controls your public health departments. That most public health departments are actually an appointed position, right? And we can see what's going on in Florida. Secretary of Health, that's all I'm gonna say. And so I'm not gonna say anymore because we're nonpartisan. But I think it's important for us to understand that local elections matter as much as national elections, because they decide who sits on zoning boards. They decide, they decide lots of local areas that we need to just think about it. So I don't want, the reason why I want to make that point is that it's really important for us to get involved. And I know our affiliates are very involved, but this is the trickle down that we see, particularly in a space like housing and community development and neighborhood environment, that it really is locally and you have to participate. And they are boring, right? I've been to those zoning meetings. They can be really technical and really boring, but they're very important for those folks to hear your voice. Because if they don't hear your voice, and the only voice they hear is the developer's voice, or those who do not have your best interest at heart. So I just wanted to kind of wrap all of us together. We got about 15 minutes. There are a couple of questions in the chat, and I want folks to know that if you put questions in the Q&A bar is where we're gonna answer the questions. Before I ask my last set of questions, I'm just gonna go to these questions very quickly or to comments. But I saw a really good one earlier that says, income is calculated on a gross annual level. Why aren't we pushing to calculate what is affordable based on net income? Thank you for the attendee who said that. I thought that was a really great question. So I'll let anybody grab that.
I mean, I'll just hop in and say, I think it's because it would make the problem look way worse. And there's a reluctance of the powers to acknowledge the scope of the challenge that we're really facing, right? To acknowledge, a lot of these like federal poverty guidelines, right, were drafted way long ago in a very different economy, and where the housing prices were different, where the housing production looked really different. Some of these things date back to pre-war era, and right, we had a huge, massive building boom right after that. We haven't continued housing production in any degree to the same way that we had earlier in the 20th century. And so a lot of these guidelines are outdated. It's just that I think, if we were to update them, or if we were to, use net income, I think that, we see that there's a much larger portion of our population that is in poverty, that's experiencing poverty. And that, it's maybe easier as a government leader to kind of bury our heads in the sand sometimes. So not to be too cynical.
No, I think you're actually 100% right, Greg. Like, we know, I was actually I was at a meeting the other day where we were looking at the federal poverty line for Medicaid, just in general, because Medicaid usually is tapped by states by 100% or 150% or 200% of the federal poverty line. And I looked at it the other day, and the federal poverty line for a family of 4 is $21,000. Really? Like, I mean, nobody can live in most cities on $21,000 for a family of 4. For a family of 4, not one person, for a family of 4. So you are not considered to be in poverty until you make only $21,000. So, like, I agree with you 100%. The food basket, all of those things is based on very old, kind of outdated data and technology. And so, right, but part of it is it is a money. It is, a whole lot more people would be eligible for services if you used the net instead of the gross. Right, that's the one. Michael.
Yeah, I think I would add, we cannot forget that housing is as much as a necessity as it is a business. If we think back 30 years ago, there was no such thing as codified affordable housing. And that was when the first LIHTC deal was structured, the low income housing tax credit. And so when we really get into this, I don't want to embrace the cynicism too much, but we are dealing with a business where profit is the bottom line. And so how do you maximize your customer base and your profits will really feed back into who has the power and authority. And we do when we show up, but otherwise it's going to be those with some of those larger purse strings who really are helping to drive this. Because again, I hate to be cynical, but we cannot forget these are major businesses where profit is a motive as much as ensuring folks have shelter over their head.
Right. And so just to put a point on that, like, I think, if businesses have a motivation here, it's right, having, potentially higher income earners qualify for the housing that they're developing, right? And so if we're using gross instead of net, then you have, potentially a better revenue stream, more secure revenue stream, a wider target audience for the affordable housing you're developing. And it's not going to, right? We look at LIHTC, we look at other programs, and you can look at the distribution of the affordability requirements, right? And, how many times do we see that the affordability requirements are for 80% AMI earners, not for the 20% AMI earners, right? The area median income. So it's not housing that's getting developed. We have a lack of affordable housing development for all people who need affordable housing. But that which is getting developed is really targeted towards the upper income stream of, what we would see as people who need the help. And very little is ever developed for the very low income earners, right? Those who are really experiencing the worst of, some of the structural forces that are keeping us, our communities down.
Okay, I just want to make sure no one else wanted to answer. No, I think that's a really good point. And so I think a question to go with that is, and you all may not have to answer, and that's okay, because it just came to me as I was talking to you. It's like, how do we change that, right? Like, we're in a capitalist society in which it's really important. Developers are trying to make money. And so are there ways that we can leverage government or other sectors to help us in helping those most that need it the most? Is there an example of that somewhere where we've done that? And maybe it's public housing, which we know wasn't necessarily the greatest experiment, but I'm just asking. I actually really don't know. So I'm curious to know.
I mean, I don't know that anyone solved this problem. What I do see, right, like, so we have different funding streams that that have been put into place at different levels, right? So if we're talking LIHTC, we're talking, some federal regulations that then get dispersed through, state, through the qualified allocation plan. So there's different levels of advocacy that can happen in terms of, how should that money be distributed? What are the requirements that we attach to that in terms of who it's actually serving? Can we force developers, through those, different channels to target more towards, the lowest income, bracket earners? Yes, I think that that's definitely something you can do. There's also, the supplemental money, right? Like all we know, all of the affordable housing developments aren't going to just be sole source on, LIHTC. They're going to look for, bridge funding. They have to pull together and cobble together all these different sources. But what are those sources that, can really be utilized to help subsidize the production of this housing down to being, qualify for, or like to be affordable for, the lowest income earners? And so I think that there's a lot of those sources that we need to look at, and I think one of the areas that we've seen some growing investment in is actually within the healthcare sector because of the acknowledged impact of health, of housing on health. And so you do see more CCOs, care organizations, you see other hospital systems investing in subsidizing, very affordable housing because they know that those are some of the highest utilizers. And as we start working on some of our insurance reform to make sure that the incentives are aligned, then you're going to get more health. We're seeing more healthcare investment into upstream prevention types of programs, and the more that we can say, hey, housing and affordable housing is like an essential thing, and to make that connection for those large institutions, that can help build the case for really making sure that housing that's being developed is really targeted for the audience that most needs it.
Ruth.
Yeah, that makes sense. So I'll build on that point and bring in just a sort of slightly alternative approach too. So we just wrapped up another one of our cohorts, which is called Community Innovations for Racial Equity, which is the sort of peer learning cohort for BIPOC-led community development corporations aiming to partner with healthcare to advance racial equity through community investments. So exactly that as a sort of growing trend. And so definitely something that we see, and but there's also a big power dynamic imbalance in approaching healthcare for those kind of investments. And one resource that we created as a result of this, which we're going to be releasing next month, is a community-driven data tool. And that's just another approach, I think, around changing decisions of what can we do with solutions. And I think grounding healthy communities, data and evaluators in the expertise and experience of grassroots communities through different approaches and practices can produce stronger, more actionable information. And I think by bringing communities to the table, the community-driven data can be more equitable and bring better strategies and help build community power through the process, I think. So there's definitely a growing interest. A lot of institutions and even community-based organizations are thinking about, community engagement, but to go further and to really think about strategies where there's community-engaged data, because I think when we're trying to transform power and place, data is such a big factor because it frames what is believed, who is believed, and then the actions that you're going to take and the solutions that are created as a result of that. So I think thinking about how we collected, who's involved, who participates in the process is really going to help change and feed into the power to make those housing and health changes. And I think one of the things that I think circling back to that vital conditions, I think the civic muscle and belonging, is that inclusive practices, that just even the agency to make a change to what you want to see in your own community is in and of itself a help and healing strategy, you know, that people are feeling agency to make that change. So kind of back to what you're saying, Lydia, that engagement, civic engagement, engagement in the process of creating the solutions is really part of the healing process. And so I'm personally excited about the potential for leading institutions to these different ways of knowing, storytelling, the power of storytelling, how that can help restore trust within communities, build community power and participation. And I think when you bring that into a multi-sector approach, you're creating a powerful platform, you know, that can, the return on investment is not going to just be your particular project you're doing, but for other projects and maybe interactions down the line that you haven't even thought of yet, but that you're building that sort of relationship. So that's just another kind of angle on creating the change through empowering communities.
Thanks, Ruth. I really appreciate that. So I think most people heard your mic is acting up a little bit again, but it's okay. I heard most of it, but I'm going to just summarize for really quickly. One, community-driven data. One of the things that Ruth said is important, that institutions start to use community-driven data, and that communities start to work in the process of creating that data and what's important to them. So I think that was a really important point that I don't want people to miss. The other one is about how civic engagement is a part of health and healing, and being participatory in the process is an act of health and healing, right? And the third one is about storytelling. So how storytelling and communities being able to tell the story of what is going on is really important to changing the narrative and also pushing toward change. So I actually heard all of it, but I just wanted to make sure that everybody got most of that point. We only have 3 minutes, and we actually have like 2 or 3 questions that I just want to get us to, so I want to try to answer them really quickly. So it says, if housing as a private for-profit industry is part of the problem, and this is a public health issue, can the view of public housing be fixed, or are they always projects? That's a really good question. I don't know if people want to dive into that one very quickly, because I think it's a really good question.
This is a hard one to dive into. I'll say this, where the investment flows is where we see investment or disinvestment, literally. And so when public housing was initially conceptualized in this country, it was highly segregated and racialized, and a tool to help folks transition into the middle class. As African Americans and others begin to really access and utilize these resources, how we invested in and managed those assets shifted dramatically. And this shows up in any research or any of the books I can suggest. And so that's really a hard nut to crack, because we would have to go back to the original purpose and tenets of public housing, and in a way retrofit those to ensure that they are inclusive and equitable. And that is the work that the league continues to do to this day. Like I would love to engage whoever asked that more in this conversation, but that I feel like that is a little bit more of a deeper issue, and then layer on the privatization of housing, the growth of the industry. And there's some other headwinds that make that more difficult to chip away at and make that easy transition.
Thank you, Michael. So I'm looking at it that we have 1 minute. So I'm going to wrap this up, because I know also Ruth has to get off at 10 o'clock her time, because she's Pacific, and I want to respect people's time. So there's a couple of things in the comments. People definitely signed on to the book that Michael mentioned, which is The Color of Laws. Also a quote from President Obama that is, elections have consequences. I also want to say this quote, thank you, Melvin, for putting this in, who put in, to answer the profit margin motive, the working poor still pay rent for housing. And so there's no free rental properties. So owners still make money, but we have to align with keeping their units filled with tenants that are working to improve and maintain a safe, viable housing. So I appreciate that comment. So I just want to say thank you, everybody. Thank you, Ruth. Thank you, Michael. Thank you, Greg. I think this was a wonderful conversation, and a conversation that we can continue to have, but just in how important it is that we understand the connection between a social determinant like housing, community development, how your neighborhood is shaped, and how it impacts people's health. And so I put a bunch of stuff in the chat also that Ruth and others were giving me that are there. We will try to see if we can put it in the YouTube. Know that this will also be on the National Urban League YouTube page under health equity, and probably about 2 weeks after we, cut and splice things. So just want to thank everybody. I want to be respectful of everybody's time. It's 1 o'clock Eastern time, 10 a.m. Pacific time. Have a great day, everybody, and I appreciate your attendance. Bye. Thank you.
Thank you.
Thank you.